one of the unique realities of HIV, and there are not many diseases that are like this, is that this was an epidemic in the first world and in the developing world, right? And that it really has affected all of humanity. And the global disparities in health and healthcare access were brought so sharply into focus. And that this is a pandemic, of course, on enormous scale, the most serious of the 20th and now 21st centuries, that also requires health systems and governments to engage and respond. So when you put that together, it turns out that it is essential to have a global convening where, the global north and the global south are together, where scientists, community, political leaders, the media are together, and where we truly can convene a global conversation about where we are and where we need to go. And I don't know of another health issue, or indeed almost any other issue, where we've been able to do this for such a sustained period of time and so effectively. And the International AIDS Conference really has become the every other year global convening of this whole community. And there have been a number of these that were just critical turning points. And they're critical turning points because of who is there. A scientific meeting among peers, which is incredibly important, that's what the IS scientific meeting is like, is critical. We have to have it, and we have to have a lot of them, and they're very important. The larger meeting where we truly convene the global community to discuss and debate and move forward turns out to be critical. So certainly, Vancouver was a landmark meeting in 1996 where, the good news of triple therapy of heart changed everything. But of course, it took a very long time to have real meaning in the global south. Durban was really, I think, the turning point of saying we cannot stay with this situation. We called it the 90-10 split, right? 90% of people treated are in the global north, 90% of people affected are in the global south and untreated. I think we've had a number of conferences that really played critical roles. Washington, D.C. was, I think, also really a landmark meeting because it's the first time as a global community that we started to say there could be an end to this pandemic. There is a way forward out of this. That was led by scientific advances. The game changer has really been understanding that treatment has this huge prevention impact, that indeed you can really reduce new infections by treating people earlier and more effectively. But owning that, having an honest discussion, talking about what it's going to take, putting forward a plan, requires everybody to be at the table. And I think that Washington was the beginning of something incredibly important. Knowing what we know now and having had this convening in DC, the next thing we have to do is get people treatment for the other half of people living with HIV who do not have access to care. So the movement for universal access now has to be understood both as a fundamental health and human rights issue, an equity issue and access to care, but it's also critical to ending the epidemic. Here we have an alignment of the human rights imperative and the public health goal, and that doesn't happen so often, and it's wonderful that that's the case. I think that certainly part of what I've done and worked on very much over the years has been what we're now calling key affected populations. Gay, bisexual, other men who have sex with men, injection drug users. We did a lot of work with IDUs in Thailand, China, in Russia, Kazakhstan, sex workers, transgender folks. And these are people who have been at the end of the line for treatment and for prevention services in country after country. It is critical, again, from a human rights perspective and from a public health perspective, that they have real access to services and care. And I think that since we're so not there, and it remains such a challenge, mostly in the global south, but also in many wealthier countries like Russia, where the lack of response to injection drug use is fueling what is still one of the only expanding epidemics in our time. This is critical work, and I think that for the 2 years that I'll be president of the IAS, this will be a very important focus. When I started in this work in the 80s in Brooklyn, we thought then that the life expectancy was about 22 months from diagnosis, and it was shorter in developing countries. So now we can't even talk about it in months, right? It's in decades. So that is great. But we're also learning, of course, that aging with HIV is going to be an enormous challenge, and there are issues that are emerging about the pathology of aging, the process of aging, that actually is helping us understand aging in all people, but where we understand that there are more and more particular burdens that are associated both with long-term therapy and with the long-term consequences of HIV infection. I think the other thing that we're right now seeing is this extraordinary beginning of scientific advances on cure. And so, on the one hand, we understand that HIV infection is a chronic, persistent, lifelong infection, and we have to deal with people as they age and have these many associated health issues, malignancies, I should add. And on the other hand, beginning to see that maybe cure research is going to yield potentially a way out of that situation. And I have been impressed, this is not my area of expertise at all, but I have been impressed at how many advances we've made just in the last few years. And I think that the IAS Cure Initiative, led by our current president, Françoise Barré-Sinoussi, is just an extraordinary example of how to harness scientific talent and focus it on a problem and start to see results. It's thrilling, and it has the potential, if some of these approaches start to pan out, to get us out of HIV as a chronic disease. Imagine being able to say, remember, it's a revolution to say that it's a chronic disease. It's a curable disease. That's a very different conversation.